Well, I initially came to the clinic because I had a rotator cuff injury, and I wasn't sure what actually was injured. I couldn't lift my arm from a fall. The arm was what actually broke my fall, but unfortunately, I had my arm rigid and it was extended, and it ended up tearing up many items in my shoulder. I didn't know what that was, so I came down to the clinic where I had an MRI done. It was about 20 minutes, and the clinicians and the doctor reviewed the MRI, and I had several partial tears as well as a bunch of other items that I can't pronounce. And so I realized that when I couldn't move my arm, that I needed some treatment rather quickly. And then I found out that they had a regenerative medicine ranch next door, and I thought I would look into that because there was an option for stem cell treatment. And later, so I looked into that. I thought that was very interesting. In the States, they wanted to cut a nice 5-inch incision in my shoulder and take care of a lot of the items. And they said I wouldn't be able to do things like swing a golf club for 6 months to a year afterward. But the whole thought of having invasive surgery, I thought I wanted to look into some other alternatives first. And the stem cell option seemed to be viable. The clinic was great. They explained everything to me. It sounded like something that I would do. I had heard about other types of treatments that work in parallel with it, like the IV ozone. But I'd never actually been in an area where that was available. And so I thought, well, the stem cell treatment along with the IV ozone, you know what, that's a great place to start. And it's possible that it may not work, but I didn't know. But I thought I would rather try that first rather than having the invasive surgery. I mean, just think about a 5-inch scar. Something else seems, another alternative seemed to be something to try first. So I ended up having the IV ozone as in before the treatment, and when I had the IV ozone injected into my arm, the first treatment, all the pain went away completely. The pain in my knee went away, the pain in my shoulder went away. That was from the injury. It was just a pain that was just there all the time. It kept me from sleeping well, and it went away after the first treatment. So I ended up coming in for the stem cell treatment. I think it was the following week, maybe the week after that. And it was a very quick procedure. And basically, I've been coming back for the IV ozone ever since. In about 2 months, I was able to swing a golf club. I didn't have the full range of motion back, but as you can see, I don't have any problem. Before the treatment, I had to move my arm with my other arm just to put it on top of the steering wheel. That's how bad my issue was. And now this is probably into maybe month 4 as a guess, maybe month 3, 4, and now no problem. Almost 100% on the motion. I can actually lift my arm up. I mean, I'm very excited about this because I didn't have to have a 5-inch incision. And also what I noticed is that from the treatments, my skin conditions have gone away. I had a mole that had a suspicious looking, for about 15 years, a suspicious looking border that I was told by a dermatologist 15 years ago to keep an eye on. And the border hadn't changed. It had been the same, which is a good thing. But after I had the treatment here, the irregular border went away. And it went away on several other skin issues that I had as well. So I just wanted to share that because I thought that was a really interesting side effect. I'm not sure what that would be termed. But now we're at maybe month 4, and I'm coming in for the IV ozones once a week. And I haven't had any issues with inflammation, nothing. In fact, I had an abdominal ultrasound done, and my fatty liver was gone. It was not a fatty liver, and I had a fatty liver for maybe 15 years from a lifestyle issue. And that had been gone, and a polyp that I had in my in my gallbladder had also been broken apart. So it was, instead of being, it was around 1.2 centimeters, and I've had that it's been there for 10 plus years, and it was noted when I had my first abdominal ultrasound, and now it has actually broken apart, and it's about, I think it was about 0.6 centimeters now. And so now the recommendation for surgical removal is gone, and now I'm looking to see if the clinic's IV ozone that I've been doing weekly may help with completely removing the gallstones in the gallbladder. So that's where I am right now.